welcome to the channel. How are you? I hope you're having a wonderful day. Oh my word, this video is going to just educate us, inform us, or remind us that we still have quack dentists somewhere in the world. This particular lady was trying to save money because in her country, UK, it was going to cost her £26,000 to have her teeth worked on, okay? But in Turkey, it was going to cost her £3,500. You see the difference? This is why people go there with the for plastic surgery, whatever. The big difference, and not think about, much about, okay, what if this is a quack doctor? So she got there, and what she got was not what she bargained for at all. Sometimes I could say, well, I mean, you still do your investigation if you think you want to go go to see a dentist or whatever you want to do. Make sure you investigate, check them online, see the rating and all of that. If I say, make sure they have the right qualification for this, some of them can fake their qualifications. Yeah, we've seen some people who fake their qualification. They put it online. They went to so university. They have this degree, second degree, PhD on this, on that, MD or whatever. Everything that is needed, they're going to put it there. But that alone is not enough. I would recommend that a health department in that particular city or country is called. They might be able to refer you to the next city you're going to, the head department there, or, they might be able to refer you to the right head department where you might be able to find out exactly if these are registered, if they have a website where you can view like a bureau that is set up for customers too, or watchdog that could say, okay, where people report doctors or dentists, whatever, where you could go and look it up. They might be able to give you that if they have one. Like Better Business Bureau, where you report everything to the government. If you think you're scammed or they're not good doctors or what they've done, whatever it is, you can report to them. Find out if they have such in that country, especially this Turkey, that is right in the spotlight when it comes to dental procedures and plastic surgery. So let's go, let's have a look and listen, see what you can learn from this or you can help someone with in the future that might want to go into Turkey, go to Turkey rather, to get their dental procedure performance. Thank you so much. Let's see.
But as our next guest found out, getting cosmetic dentistry in Turkey can be very, very expensive and a painful mistake.
After cancer treatment left her feeling insecure about her teeth, Sarah Watson flew out there in the hope of achieving the perfect smile with veneers.
Yes, but instead she returned home with rotten gums, excruciating sensitivity and a huge bill to get everything fixed. She's joining us now alongside dentist Dr. Trishala. Thank you for joining us.
Good morning.
Thank you. Because I have met so many people that have gone to Turkey, some of them absolutely brilliant job, and the other half of them, they've had nothing but an absolute nightmare. Now, I've got to say, your teeth look absolutely beautiful now, but you've been through the run of the mill with it, haven't you, to get them? So what happened with your teeth at the beginning? You were going through chemo, weren't you?
I had chemo tablets and radiotherapy, so that was left me a bit debilitated and a bit down, and your teeth sort of crumble a little bit. Your gums are not strong enough because you take that tablet for 5 years, and I had 18 sessions of radio, which is quite a lot. So I was a bit disheartened about my teeth. My hair was thinning, and so I just wanted, that's okay, I'm fine now, but I just wanted to have a nice smile.
Yeah.
So most importantly, how are you?
I'm very well, thank you. Yeah, I'm really good now. I'm in remission, so that's really good. So,
well done. You look great.
Thank you
really
so
healthy
much.
and great. Okay, so you got a problem with the teeth. You want a solution. What were your options at that stage?
Well, I never even thought about it till my cousin had gone to Turkey, and I thought, well, her teeth look amazing. I rang her. Yeah, brilliant, Sarah, she said. So that was the start of that, and I decided to jump on board.
Were there UK options?
There was. I had gone to one dentist in London, it was £26,000, which was way out of my price range.
Oh, my word. Okay, versus...
Yeah, 3,500.
Okay.
Right, okay. So did you read all the reviews at
No.
Turkey? Oh,
No.
right, you didn't read the reviews.
No.
But, your cousin had been to the
Yeah,
same
I just took her
practice.
recommendation and, I went on board, and I really wish I'd done my homework, obviously. I would never recommend anybody doing what I did.
But I can see, in your defence, I can see 27,000 here versus 3,500 over there.
There was no brainer. I just thought, I'm just going to need to do it. Husband wasn't happy, but I thought I needed to do it.
What did he say when you told
No.
him you were going to Turkey?
No, but then I've been through so much, so he gave in the end. He's so cute.
What were his concerns, and did they come to fruition?
His concerns were what happened, basically, what happened to me in the end.
Okay.
And he was right.
So, Sarah, you've got to Turkey.
Yeah.
What happened then? Did you go straight into the dentist when
I
you
went
got there? Or?
I slept with my money under my pillow.
Did you?
I was so frightened. Because it was cash, they only take cash.
Do they?
That should have been a red flag. Anyway.
Can I ask just a real basic question? When you go in there, does it look like a normal dentist surgery? Are there red flags?
No, it was like a reception room, then a room with glass, and then the dentist is there.
Does it look professional? Does it look...
Sort of, yeah. I didn't really think about it, but I went to pay the money, and he said he just counted it next to me, and then said, go in.
And do they put you up in a hotel?
They do. It wasn't really a hotel. It was like a bed and breakfast, but it was fine. There was nothing wrong with that. It was just, there was no consultation, I sent them pictures, and then I was there in the chair, and they were taking out teeth. They removed 6 of my teeth.
He'd not spoken to you. You've gone in there, he's not spoken to you, he's not said a word, he's there taking out 6 of your teeth.
They started at the bottom, then they did the top the next day.
Oh, my word.
Yeah, and then they fitted, and that was ridiculous. It was all done in 2 days, the first lot, and then afterwards it finished, yeah.
And there the nightmare began.
There we go,
Talk
yeah.
us through the next steps of that.
So I got home, and my husband said, is they all on one bridge? I said, which is one thing. I said, well, what happens if anything happens to your teeth underneath? And I had this gap here, right here, because they removed 2 of my teeth. And I kept thinking, there's food going under there. It was big enough to put my nail underneath. No. And it didn't. And then I kept thinking of it. This is 4 years on. So then it sort of became loose. The whole bridge became loose. I was eating. And then I made a TikTok, and it became loose about my teeth becoming loose. And that's where it went. So I had to go and see a dentist here.
Oh, my word. So at that stage, you knew this has gone wrong.
They're coming off. They were coming off, and I would have been left with the points shaven.
And the cost of the fix and the length of time for the fix, how long has it taken?
For now, we're up to about nearly 15 now, thousand.
Oh, my word.
And 18 months. I'm still going now. I had 2 implants fitted 2 weeks ago. So I'm still waiting for the gums to heal on that, and then I'll have my implants fitted, screwed in, and then the rest of the work finished.
So you thought you were getting screwed in implants?
I know, I thought I was going to get individual teeth over the top of my teeth. I don't know what they call them, but it never happened.
Oh, so you thought you were going to get the individual teeth over the top of your teeth. So they shaved your teeth down, and they just give you one straight
bridge,
shield.
and they didn't even fit it properly. So the gap here, where they took the teeth out, they shaved the teeth this side and this side, but didn't fit it down to fit this over here. So there was always that gap in there.
So did you have any gaps then, or?
Yeah, underneath here, yeah.
No, but did you have any gaps in between?
No, nothing.
Teeth?
No, it's all on one bridge.
It's like a one piece.
You can't floss.
One big.
You can't do anything. Yeah.
Dr. Trishala, just from the moment that she walked into the surgery, the fact they started working straight away, how shocking is this to you?
I mean, I would not dare to do any treatment on a patient without speaking to them first, obtaining their consent, let alone just taking somebody's teeth out. I think this is a really, really good learning lesson for those who are considering going abroad for dentistry. And we must say, we have some of the best dentists in the world in Turkey. This is not all Turkish dentists, but obviously it's a bit of a phenomenon right now. But always ask questions. And if they can't speak the language, there's a language barrier. Ensure there's a translator. Don't be embarrassed. Don't be scared to ask questions. Ask what the other options are. What are they doing? Why are they doing it? We'd get asked this in the UK, so please do not hesitate to ask those questions, because taking somebody's teeth out without their consent is just, it's diabolical.
The only thing is, Dr. Trishala, once somebody's gone to Turkey, not a lot of people want to help then, do they? Because they feel that that's their work, and if you're to take on their work, that's then your responsibility to try and fix something that it's like trying to fix, I suppose, a house that somebody else has built incorrectly.
Absolutely, it's more complicated than doing the initial treatment in the first place. And the MDDUS, which is a indemnity organisation, say there is no requirement to undertake remedial work on the NHS contract except for assessment and appropriate pain relief. So if somebody is in pain, please do see an NHS dentist, because it's our job and our duty to ensure you are out of pain. However, this does not mean we can then undertake the whole treatment again. But yes, a lot of dentists will be extremely hesitant to touch these patients because it's very complicated. I mean, you know yourself that the risks of this are extremely complex and require specialist treatment a lot of the time. And a dentist can say, right, I don't feel comfortable treating you. This is out of my scope, so I may have to refer you somewhere else.
The reason Sarah bravely came in today, and thank you for doing this, because you want to help other people out there.
I don't want anyone to go through what I did,
And really thank you for that on behalf of anyone who's thinking about going to Turkey. We've established, you've said, that there are some good dentists out there. There's some bad ones. So just to everyone watching today who are considering this, what advice can you give them? Really practical advice to make sure they get the right person.
So recommendations obviously count for a lot. I know you had recommendations, so obviously that alone is not enough. But maybe even look into the qualifications the dentist has. Just make sure they're dentists, they've had the right skills, they've had the right training to undertake the treatment that you require, the treatment that you want. Again, the translation is crucial. A dentist should be telling you the pros, the cons, the risks, the other choices, the other treatment choices, so veneers, composite bonding. They should tell you all of this. So communication is key, and to obtain consent and informed consent, you have to be speaking the same language. So please ask for a translator. Don't just go into the chair and all of a sudden, you know, have treatment. Please stop them. And of course, just somebody looking at pictures of your teeth and then saying, right, I mean, I know this firsthand. I mean, we did a documentary a few years ago. We sent pictures of my teeth. I haven't had cosmetic work done, so I know it could have a little improvement. But my teeth, we sent pictures of. 70% of the 120 clinics in Turkey said I needed crowns and veneers.
No way.
You can't say that from just looking at one picture over Instagram DMs. So that should be a big red flag in itself. That is not enough if you're just sending pictures. You have to be seeing them in person for an assessment, x-rays, and in-person physical examination. So please pick up on those red flags and don't ignore them just because the price is a bit cheaper, because it may save on the financial costs, but long term you'll suffer with your biological costs.
Definitely,
Yeah, and as you said, there's good and bad, but and read the reviews.
Absolutely, yeah.
Nearly there, Sarah.
I nearly am.
Absolutely.
Any more treatments left?
I've got a little bit more to go and then I'm finished,
Well, they look gorgeous
Thank you
now.
so
So I
much.
know you've been on a long road of it.
Yeah,
But yeah,
it's nearly
well
at the
done,
end
Sarah.
of it now. Thank you so much.
You look,
Good on you.
they look really
Thanks for telling
good.
your
Thank you,
story.
Sarah. Thank you,
Good
Dr.
advice.
Trish.
Oh, wow. We've learned a lot today, isn't it? I like what the dentist that was with her spoke about. You know, just don't send your picture. And then from that picture, they tell you, well, you need a crown, you need veneer, you need this, you need that. No, I would suggest that people should just go first, go visit the place, visit the place, look at the place, see that you are satisfied with what they're doing, for who they are, ask questions, like she said, get it interpreter, insist on interpreter. Or if you have a friend that speak that's from there or from where you go coming from to Turkey, that can come with you, if you could pay their fare, you can. Or put them, these days you could just put them on Zoom, FaceTime, and let the person interpret, because if they bring interpreter, they can also influence that interpreter to exactly to tell you what you want to hear, because you don't actually understand the language. So that's another barrier right there. So if you have someone in the country where you live, talk to them and say, I want to go do this, but this is what I want to go first. I want to go investigate the place, or I'm going there to get it done. I want to ask questions. I want to put you on a FaceTime, on a Zoom. I want you to interpret them to me. I want you to be honest with me, because I don't want to die. I don't want to come back, with some of these stories that we're hearing everywhere. So you want to talk to the person. That if you can find such a person, that would be cool. Excellent. Then remember, if anything goes wrong, you'll be spending more than you bargained for. She was trying to avoid paying £26,000. She get it cheaper. Anyone will do that. Anybody will want to do that. I will want to do say, oh wow, it's cheap out there. Hey, I'm saving myself about 20,000. Let's go. So you want to check first. Why are they so cheap? So now she spent so far £50,000. She said they still have more procedures to go. So she's spending more with the pain, with all that she's been through. So please put this in your heart not to just go. If you can afford to visit first, I will recommend that. Visit the place, go with someone or FaceTime somebody, ask all the questions you need to ask, then make a decision to go back and get a procedure done. Please let me know what you think about it. Leave us a comment, and please remember, your wisdom will help somebody else. If you find someone that you say, you know, they want to go through this procedure, say, listen, this is, go watch these videos, go online, find this out, so that you help them prepare properly and make intelligent decision. Your word of wisdom could save a life or save somebody from excruciating pain. Thank you so much for watching. Please don't forget to like, share, click notification button so when we're on, you will be notified. I do appreciate your time. Bye. Bye for now. See you next time.